Hi, I'm Krista. I'm going to be your student massage therapist today. So today we're going to do a cranial assessment. So what I'm going to be doing is doing different small tests that are going to test for each cranial nerve. So you have 12 cranial nerves. We're only going to test for 11 of them. There's no real risk to doing these assessments, just that you might feel a little pain and discomfort, maybe some different sensations. But if it gets too much, just let me know. We can stop or modify if we need to. The benefits of me doing this assessment is so that I can provide you with a safe and effective treatment. And do you have any questions?
No.
And do I have your consent?
Yes.
Perfect. Okay, so first we're going to do is cranial nerve 1. So cranial nerve 1 is called olfactory nerve. So what that tests for is it tests for smell. So what I'm going to get you to do is I'm going to get you to close your eyes, cover one nostril, and I'm going to get you to smell this and let me know what it smells like.
Coffee beans.
Okay, good. Next we're going to do is, you can open your eyes, next we're going to do is cranial nerve 2. That's the optic nerve. So what we're going to do is we're going to test it tests for the pupillary reflex. So what I'm going to be doing is I'm going to be shining a light in your eye just to see if your pupils constrict when they're supposed to and dilate back when they're supposed to. Okay? Okay, so right now they're normal dilated like they're supposed to be. And I'm going to shine the light. Keep your eyes open. Okay, and they constrict and then dilate back. Good. Next we're going to do is cranial nerve number 3, which is the ocular motor nerve. So that's just has to do with the position of your eyelids in correlation with your pupils and your iris. So what I'm going to have you do is you're going to look straight. Just look straight ahead. Okay. And then look up without moving your head. Good. And it does, your eyelids do cover your pupils a little bit. Okay. So next what we're going to do is cranial nerve number 4. So cranial nerve number 4 is called trochlear. And what that is to test for is to test for the okay, so cranial nerve 4 is trochlear, and trochlear, it tests for the this one also tests for the position of the eyes. So what I'm going to have you do is you're going to look straight ahead, and then you're going to look straight at my finger and cover one eye. So then I'm going to move this, just follow my finger. So you're going to move it medial, and then I'm going to move downwards. And that tests for the superior oblique muscle. That's the word I was looking for. Okay, so next we're going to do cranial nerve 5, which is transdermal nerve, and what that tests for is for facial sensation. So what I'm going to do is I'm going to test your sensations with this cotton swab that's been cut. So if you can hold out your hand for me, and then let me know if this is a soft or a sharp touch.
Soft.
Okay.
Sharp.
Okay, good. So now what I'm going to have you do is you're going to close your eyes. I'm going to do the same thing I'm going to do it on your forehead, on your cheek, and on your chin. And you tell me if you feel a sharp or a soft sensation, okay?
Mm-hmm. Soft. Hard. Rough. Soft. Sharp. Soft.
Okay, good. Next we're going to do is cranial nerve number 6, and that is abducens nerve. So what that's just going to test for is just to see if your eyes, it's just another one that tests for the position of the eyes. But this one is just to see, you're just going to look forward. So look straight ahead, and I'm just going to be looking at your eyes for the next 15 seconds just to see if your eyes shift anywhere as you're looking directly straight at an object. And they look fine and you're looking straight. Okay, next we're going to do is cranial nerve number 7, which is the facial nerve. And that has to do with facial movements. So what I'm going to have you do is I'm going to have you raise your eyebrows. Good. I'm going to have you smile. Okay. And I'm going to have you puff your cheeks. Good. And then I'm going to have you close your eyes. Good. Okay, and then next we're going to do is cranial nerve number 8. Cranial nerve number 8 is vestibular cochlear. And what that's going to test for is I'm going to be using this tuning wand. And what I'm going to do is I'm just going to hit it. Actually, if you can put your hair back right here. So, okay, so what I'm going to do, I'm going to hit it. I'm going to put it up against your mastoid bone. You're going to feel a vibration. Well, this is what should happen. You should feel a vibration. Let me know when the vibration goes away. After it goes away, I'm going to take it off. I'm going to put it in front of your ear, and you let me know if you still hear the noise that's coming from this, okay?
Mm-hmm.
Okay. Do you feel a vibration?
No.
No. Can I put it again? Do you feel it now?
Yeah.
Okay. Tell me when it goes away.
Goes away.
Gone? Okay. Do you still hear it?
Yes.
Okay. Good. The next one we're going to do is cranial nerve number 9. Actually, cranial nerve number 9 we're not going to do. That's the glossopharyngeal pharyngeal nerve, and that has to test for the gag reflex. So I'm not going to put anything in your mouth to test your gag reflex. But I'm just letting you know what it tests. So we're skipping that one. So the next one we're going to do is cranial nerve number 10. That's the vagus nerve. And so what you're going to be doing is you're just going to open up your mouth. You're going to say, ah. Okay. Yep, perfect. And what it's testing for is to see if the soft palate elevates. So if it raises up when you say, ah, then that means that nerve's functioning properly. So next you're going to do is cranial nerve number 11, which is the accessory nerve. So this it's basically pretty much like a manual muscle test for the sternocleidomastoid and the upper trap. So what I'm going to do is I'm going to hold right here, and against my resistance, you're going to try and shrug your shoulder. So lift your shoulder up. 5, 4, 3, 2, 1. Good. And then the last one we're going to do is hypoglossal nerve, which is cranial nerve 12. So what you're going to do, you're just going to stick your tongue out. Okay. And it pretty much goes straight out. It doesn't, if there was a problem with this nerve, it would deviate to one side. So we're just pretty much looking at the protrusion of the tongue. Okay, and everything seems to be working and functioning good.